Horsemen and women strive to have their standardbreds in tip-top shape on the racetrack. And when a horse's performance is lackluster, there could be many reasons. Trainers and owners often are able to figure out what the problem is, but if they can't put their finger on it, they can recruit the help of a veterinarian in search of a diagnosis. On this day, we visited Dr. Paul Hanebutt from Brenford Animal Hospital. Owner Susan Skinner brought one of her harness horses in to get a special procedure done called a gastroscope. After Dr. Hanebutt and Susan discussed the horse's performance and recent behavior and eating habits, it was time to see if ulcers could possibly be the culprit.
So we're going to do a gastroscope exam on this guy with a history of poor racing performance. Not consistent poor racing performance, but sometimes that's enough to indicate that we might have some stomach ulcers. So we're going to look in his stomach, and we're going to try to get into his small intestine, to his duodenum, which usually we can get in. It just sort of depends on how his stomach is. And sometimes, I know you probably stopped food last night at 6 o'clock or 8 o'clock or something.
Yeah,
so,
8 o'clock.
Yeah, so hopefully there's nothing in their stomach. I've had some of these guys fasted for 14 hours and there's still a ball of hay in their stomach. We won't know till we get there, so we'll see what we got. So we're using a video gastroscope unit. It has water that we can push through the scope. It has air we can push through the scope. It makes a lot of noise. The compressor's not a quiet little compressor. And the little camera is in the very end of this. Used to be, these are all fiber optic units, and we had to look through an aperture to see what we were looking at. This thing hooks up to my laptop, and then we'll see the picture on the screen of the laptop. So we're in a nasal passageway. Those are turbinates in the airway. I'm gonna go back and look at his voice box, which is right there, and he's swallowing. Okay, do a still shot of that. And then click on the video. Yeah, and go that. We're just going to watch his voice box move a little bit while he's breathing. So both of his vocal cords are working well. So we're in his windpipe right now. We're just looking for mucus and blood, just in case. I know he was examined, but sometimes you don't see blood for 24, 48 hours after they race, so you can get really fooled. You think that there's nothing going on, and you get into trouble. So this scope is long enough that I'm going to be able to go clear down to his lungs and look at what's called the bifurcation between his right and left lung field. So sometimes if a horse is sick, with this long scope, I can look way down in there and I can see if there's mucus. And we could go further in with this scope because I got another couple feet, but we don't really need to. We're just looking and there's no mucus, there's no blood, it's not inflamed. You can see all the little normal blood vessels all around the edges there. So to me, the respiratory tract is pretty darn fine. So now we're going to head to the stomach. Okay, we're in the stomach. And this is kind of normal mucosa, and there's two parts of the stomach, and I'll show you the difference. That you can tell a big color change difference when this is the upper part of the stomach. Okay, go ahead and advance it, Aaron. And that extra yellow is not normal right there. It's called hyperkeratosis. That's where the lining is a little bit irritated. It's not really an ulcer, but if you went in there and you could peel that yellow stuff off, it would be a little bit of a wound. So all this yellow stuff, so this is the upper part of the stomach, and this darker purpley pink stuff is the lower part of the stomach. And that's kind of normal. And the line between the two is called the margoplicatus. It's just an anatomical description of the division of the upper and the lower part of the stomach. And that puddle of fluid is, I'm going to go into that in a minute, and that's going to take us down into the small intestine, into the duodenum. And then we'll look for, sometimes you see ulcers in there too. But he's Susie, this is disease. All this yellow shouldn't be yellow.
Okay.
It should be pink, like this over here.
Okay.
And so the stomach acid has been a problem for him. It's not tragic. Oh, take that picture, please. And that's where loop back around the stomach, and you can see the scope has gone around, and I'm looking back at where the stomach comes in. He definitely has some stomach disease. We categorize these 0, 1, 2, 3, or 4, 0 being 100% normal, 4 being really tragic. So he's a 2 or maybe a 3 for me,
okay,
because of what's called the hyperkeratosis, that yellowing.
Okay.
Back it out here. And so he needs to be on Gastrogard and probably sucralfate at the same time, or omeprazole.
Is this like stress induced? So like
Sure.
we give him all
And he
all
rests
high
him, and he
super-
feels better, right? His stomach has time to heal. Increasing his hay intake, if you could, and moving to like 100% alfalfa hay is better. It has a higher calcium content, which buffers the acid in the stomach.
Okay.
And you just have to watch his GI, because he might get soft stool, but his bacteria in his gut will adjust.
So it's looking like the gastroscope found inflammation, which may be the reason for the equine's recent poor performance. After the procedure, Dr. Hanebutt and Susan revisit what was seen during the exam and discuss treatments to help with healing her horse. And then I got a chance to talk with him as well about how amazing modern medicine is when it comes to helping our big, beautiful athletes.
Well, we live at a time when we have lots of cool toys. We probably still aren't in a position where we can do MRIs and PET scans and CAT scans of horses' abdomens and stomachs because of the mass of their body. But at least with these kind of toys, we can see what we need to see to help get these patients back to normal. There are other more sophisticated forms of this unit. There are some that are totally Bluetooth. We don't have to have all the computer wiring and that kind of stuff. But you still have to have some source, some light source and some water and air to be able to clean the stomach and be able to dilate things so you can look at the tissue. So it's great stuff. One of the things we have to rule out besides soundness is medical issues. And so a medical issue that can contribute to poor performance is stomach ulcers or irritation in their stomach. Like this horse doesn't have out and out ulcers, but he's got all that yellowing around the lining of the stomach and down low headed to the small intestine. And that's inflammation, and it's chronic inflammation. But we do have 2 good drugs in omeprazole and sucralfate that will calm this stuff down. So hopefully we'll treat him for a month and he'll be normal, and we'll see him in the winter circle at Dover and Harrington and Chester and wherever he gets to go.
Thank you to Dr. Hanebutt and all of our wonderful veterinarians who give our horses incredible care so we can keep them happy and healthy.